debate on National Dermatology Hospital, Garkida Agricultural State Establishment Bill. Mr. President, my distinguished colleagues, as far back as 1929, an international hospital was established for Garkida Agricultural Leper Colony by the Church of the Brethren Mission, United States of America. It was an ambitious effort located on 2,500 acres of land designed for treatment of leprosy and other illnesses, isolation center, and training of lepers in craft and improved agricultural methods. It was a reputable hospital with 12,507 leprosy patients admitted between 1929 and 2002, with reasonable number of patients coming from neighboring countries. With the advent of antibiotics in the 1940s and the use of dapsone to treat leprosy, the role of the hospital changed. Dr. Roy Falzagraf, the medical superintendent, transformed the hospital to an internationally well-known center for developmental work in surgical rehabilitation, physiotherapy, protective footwear, prosthesis, and training. In 1976, the Church of the Brethren Mission made the hospital to become an international referral center for leprosy and dermatology patients. The Church of the Brethren Mission ran the hospital until 1976, when it was handed over to Ecclesia Nyanguwa Church in Nigeria, EYN. The EYN had minimal capacity to maintain the hospital at an international level. Therefore, the Netherlands government took over the hospital and ran it for 2 years before handing it over to the Ministry of Health of the former Gongola state. Mr. President, my distinguished colleagues, it is unfortunate that 92 years after, this noble work of providing tertiary health care at the reach of the common man was neglected and allowed to decay in vigor and extent, thereby became weak and inconsequential. I am, however, encouraged by the effort of the federal government in providing specialized health care for specific clusters of diseases, such as National Orthopedic Hospital, Senator Mandia, National Health Care, such as National Orthopedic Hospitals, National Eye Center, National Psychiatric Hospital, National Ear, Nose and Throat Hospital, and National Infectious Diseases Hospital. Notwithstanding, Mr. President, distinguished colleagues, I want to draw your attention to the fact that the existing International Tertiary Dermatology Hospital in Garkida, Adamawa State has been conspicuously left out in the federal government's drive to provide tertiary health care services to Nigerians. A dermatology hospital to provide diagnostic, curative, promotive, and rehabilitative dermatology, cosmetic dermatology, allergy, all skin and hair treatment is seriously and urgently needed to fill the gap, and the Dermatology Hospital Garkida Adamawa State naturally fits all the requirements for a national dermatology hospital. There are many reasons for a national dermatology hospital in Garkida. One, the hospital will allow specialty care providers focus on particular areas of care in which they have extensive training and education. Two, the tears and frustration expressed by patients with pigmentary disorders and the psychological impact of those disorders will be effectively handled by the hospital. Three, skin cancer experts and other areas of skin condition will be produced from the academic section of the National Dermatology Hospital. Four, it is a well-known destination for patients all over the country for nearly a century. Five, limited infrastructural and academic template for an international dermatological hospital already exists. Six, the hospital will provide sustained leadership in patients' care, in research, and in training leaders of dermatological specialty in an environment that fosters creativity, diversity, inclusiveness, and synergy leading to a regional and national recognition for their clinical expertise and teaching. 7, the host community will benefit from improved access to services, enhanced health of the community, advanced medical knowledge, and reduced government burden. 8, hospital tends to be the largest employer in the healthcare field in their given areas, and it is expected that hospital will help stabilize the economy, the community's economy, and promote careers in health, particularly at nearby high schools and colleges. 9, the people of the Northeast geopolitical zone, and especially medically underserved, low-income, and/or minority population will be served. 10, much needed federal government presence will be enhanced by the establishment of this hospital, a project that is long overdue. On this note, Mr. President, my distinguished colleagues, I urge you to therefore unreservedly support this bill, as this will provide the much needed healthcare and academic services, as well as restore the lost glory of the international nature of the hospital in Garkida, Adamawa State. Thank you for your usual support.
Chief Whip. Thank you, Mr. President. My name is Oji Ozokalo. I represent Abia North. In supporting the bill by Senator Binani, I want the Senate to consider that zone has been chemicalized, and a lot of skin diseases are coming out of that zone now because of amount of bullets and amount of weapons being used to fight Boko Haram. So I don't want any of our colleagues to waste time in supporting this motion, because it's a very, very good thing, because a lot of leprosy on that area and skin diseases on that area of our country. So I urge all my colleagues to kindly support this motion and support this bill, which will be to benefit of people of Northeast, not only in Northeast, but other Nigerians who used to go to India and all the places to treat their skin diseases. Thank you, Mr. President.
I want to congratulate my distinguished colleague and my chairman for sponsoring this bill. This is an important bill. Going through the historical trajectory of this hospital, it's rather unfortunate that an important asset like this have been neglected. I've gone through the reasons that the sponsor of this bill advanced for the need to revitalize and re-energize this national asset for the benefit of Nigerians. And I think there are others. Mr. President, we are moving around a cloud of microorganisms, viruses, bacteria, and droplets of chemicals that are very, very dangerous to the body. They find their way into our body system. In addition to this, Mr. President, because of our climatic situation, we're exposed to ultraviolet radiation, which can also damage our body. And also, there are a lot of anthropogenic activities that we engage in that also stands a good chance of damaging our body or our system. Last week, we discussed the issue of cosmetics, that application of cosmetics can do a lot of harm to the body. So for all this, Mr. President, the first line of defense of our body is the skin, the epidermal layer of the skin, with our melanin and also the keratin. And if this first line of defense is compromised, life will be endangered. And so the establishment and revitalizing and re-energizing this hospital, which has been a referral center, is something that is desirable, because it's going to invite, or rather concentrate a critical pool of dermatologists that will be in situ to address the various types of skin diseases. Somebody mentioned leprosy, psoriasis. At times when we take some drugs, it causes some immunological reaction that breaks out rashes in our body. So this is an important branch of medicine that has not been given the necessary emphasis. Having said this, Mr. President, I rise to second this bill and to plead with my colleagues that they should support the second reading of the bill. Thank you, Mr. President.
Senator Bikula Amosu.
Thank you, Mr. President, distinguished colleagues. My name is Ibikunle Amosu. I represent Ogun Central. First, let me join my colleagues in commending the efforts of distinguished Senator Aisha Tudayo. Mr. President, when you read this, the lead debate on the establishment of this specialist hospital, you will feel sorry for us because this is the bane of our nation. We lack what we call maintenance culture. How on earth can we allow an hospital that is almost a century-year-old? In 8 years' time, this hospital will be 100 years old. And somehow, under our nose, we allow the hospital to degenerate. So much so that if you go there, because I actually engaged the Senator Dial, and she did mention the parlous condition of the place. So, Mr. President, I think this, if we get our act right, things like this should be avoided. All our institutions, all our dated institutions should be kept, should be well maintained. You will go to in other climes, you will see they will tell you some hospitals, they are almost 200 years old, some 80 years old, and they are still functioning well. Indeed, with time, practice made perfect. All these hospitals, when they are well maintained, they become a world known referral centers. And that is why you will see us traveling far and wide outside the shores of Nigeria for things like this. Let me now get back to the nature of the hospital. Anything, we are human. Anything that will affect us, if you see anybody, whether you want to even marry, either you are a man or woman, you look at the person you want to see. You want to see the skin. When the skin is affected, of course, this has some psychological implications. Negative one. If you've seen people with skin pigmentation, you won't believe even their confidence is affected. Beside all of this, if we are able to support this bill and the hospital is eventually established, you will discover that it will be a morning spinning venture, because if you get it right with true researches, our doctors, our specialists in skin disorder, they will come up with things. Look at our population alone, not to talk of West African sub-region. They will come up with researches to pinpoint the necessary things that we can do, we can use. And you will see that all our pharmacists, everybody, will get to work. They will come up with necessary drugs that can cure all of these things. Look at skin cancer as we speak today. Mr. President, you see those that are affected with this and the kind of money that they are using to go around the world to find cure for this. Will tell you that this is one bill that should be supported. I will want to plead with our colleagues that all of us should support this bill, and when it is eventually passed and this hospital is established, you will discover that it will more or less become a referral center that everybody, any kind of skin disorder will go. And not to talk of the economic implication of this to where the hospital will be located and to us as a nation. So I support this bill wholeheartedly, Mr. President, and I want to enjoin my colleagues to so do. Thank you, Mr. President.
Senator Matthew Orogide.
Mr. President, my distinguished colleagues, I stand up to lend my support to this bill. I want to commend distinguished Senator Aisha too for bringing this bill at this point in time. Mr. President, my support for this bill is based on the available statistics of tertiary health institutions that we have in Nigeria. And then, of course, the very huge gap that we have seen in the establishment of specialist centers for the cure of skin diseases. Just like this bill referred in one paragraph to other existing tertiary health facilities like the orthopedic hospitals, the eye hospitals, and the cancer hospitals, the kidney hospitals. The one that is clearly not made for is our dermatological referral center. Therefore, this one that had been in existence since 1929. But just because of the way we handle our institutions, the negligent tendency in the maintenance of our health facilities, this hospital today ought to be very well established. We can see the trajectory, how it has come from the church mission up to state governments and then of course federal government. So this be asking for it now to be formalized as a referral center that can take care of those skin diseases. I just believe we should not waste time in accepting this, Mr. President. It is a well-informed bill, and the way it is for those of us who are very zealous about providing tertiary health facilities to our teeming populace. This one is one institution that we need at this point in time. I so support it. Thank you, Mr. President.
Deputy Man.
Mr. President, I want to add my voice in support of this bill. But before that, I want to appreciate my colleague who has refreshed our memory this morning by taking us down to the part of history, particularly those of us from that part of the world. Mr. President, as a growing young child, Garkida was very known to me. And it became famous because of the presence of this leprosy center. As she explained in the lead debate, the center attracted patients across the nation and even beyond the borders of Nigeria. It was so effective because the missionaries who were managing this center proved truly their ingenuity and expertise. But today, the community that hosted this center appears to be reduced to a rubble. And why I'm saying this, because if this bill scales through this second reading and eventually this specialist hospital is established, it will be a clear signal to the world of evil that evil will not prevail over good. Because what the evil world is trying to do is to downgrade the community of Garkida, which was very famous for doing good for people who suffered from leprosy. And I think this is a bold step in the way to tell the world that we will not be distracted by activities of criminality in the Northeast. And it is in this direction, Mr. President, that I rise to add my voice to this, that this bill be given the needed support by this chamber, and that the dream for this specialist hospital will be achieved. Thank you, Mr. President, for this support.
Is there anybody against the bill? In favor of the motion that this bill be now read a second time, say aye. Those against, say nay. The ayes have it. Clerk of the Senate.
Mr. President, distinguished senators.
A bill for an act to establish the specialized National Dermatology Hospital at Garkida for the prevention, diagnostic, curative, promotive, rehabilitative, cosmetic, allergy of all conditions and disease affecting the skin and for other matters connected therewith, 2021 second reading, and the bill is referred to the Committee on Health to report back within 4 weeks. Thank you very much. Leader of the Senate.